Heart sound assessments, your anatomical landmarks to listen to your valve closures. Your aortic valve is going to be located on the right side of the heart, second intercostal space down. Your pulmonic valve is located on the left side of the heart, second intercostal space down. Then you've got your Erb's point. The Erb's point is where you're going to hear your S1 and S2 best simultaneously with the bell of your stethoscope. And then when you are going to listen to your tricuspid, this is the fourth intercostal space. And moving over to the mitral valve or your apex, this is the fifth intercostal space, mid-clavicular line. You listen to this for 1 full minute. All patient takes meds is how I remember it. And follow me for more nursing tips. Have a great day.